Are there any additional comments, corrections, additions, deletions? Seeing none, all in favor say aye. Aye. Opposed, nay. We now have the agenda. Public comment. Is there anyone that would like to address the board? Seeing no public comment, we will move on to committee items. First, we have the December 7th, 2015 meeting minutes in front of you. We have a motion and support to accept the meeting minutes as printed. Any additions, deletions, corrections? Seeing none, all in favor say aye. Opposed? Meeting minutes accepted and approved. Lifeways monthly report. Well, hello and welcome back.
Good afternoon. You all received a report in your packet that I'd like to go over some highlights for you. The first one is related to our access diversion data. We have an access department that provides services for individuals coming in for services and also for assessments into psychiatric inpatient settings and also to divert people to community-based services to keep them out of the inpatient settings. We have fiscal year 14 and 15 data here. We also have instituted what's called an ICS team, an intensive crisis stabilization team, to provide services to individuals in their homes, either individual homes or family homes, to provide crisis stabilization supports for up to 2 weeks to try to manage a crisis to divert them from an inpatient setting. So you'll see the data there. We have a current diversion rate of 60%. People presenting for inpatient services being diverted from inpatient services. And we've seen an increase in the number of people presenting both in the ER for crisis services and for crisis intervention services on our facility site. And we think that some of this is due to the Healthy Michigan enrollment, so more people have insurance and they're seeking out services now. Excuse me. On the second page, we have some prevention and wellness activities we're participating in. We recently received a Comerica charitable grant of $5,000, and we're running a Wellness Wednesdays program for consumers that we are currently serving. We ran a similar program last year. We had music therapy, art therapy, some potlucks, and some social gatherings for individuals to promote wellness, and had a really good impact for some individuals who maybe did not have access to services previously. So we'd like to present a program like that again this spring. We have Project Aware, which is working on partnerships with the local schools to make sure we have some school-based mental health services in place. And we're doing outreach now to the Hillsdale Community Schools. And we recently, in September, we were able to host 2 mental health first aid trainings for law enforcement. So individuals who were officers, probation officers, parole officers, those types of individuals. Between the 2 counties, we had more than 40 individuals participate, and we are now seeking grants to have a train-the-trainer model, to have local law enforcement trained to be able to train their staff also. For our local PIHP Mid-State Health Network, recently there was a realignment of the health plans in the state of Michigan, and based upon that, we have health plans in our region that are working on some comparison metrics between the community mental health programs and the health plans to be able to be measuring the same types of issues because we have so many shared consumers. So in your packet, you'll see that there are 3 shared metrics that they're working on. Identification of and access to a joint member, so individuals that are served both by the health plan and by us to coordinate care better. Development of a joint care management standards and tools, and implementation of a care management process, so that we are working collaboratively with the health plans on the behavioral health side and not in silos. The state waivers were approved and they will be combined into one monster waiver. So that is our I-Plan waiver, our habilitation supports waiver, our children's waiver, and our SED waiver. They will be one waiver. The notice is actually out right now for a 45-day comment period to be implemented in March. So for us, they were segregated waivers for a specific population type of individuals to be served, and now it will be one giant waiver for the individuals to be served. The autism expansion, which I talked briefly here last month about, was approved. It went into effect January 1st. And so this is the autism service benefit that now expands from 6 years old to 21. Previously, Medicaid covered individuals who were 18 months to 5 years. Now we are able to serve individuals under Medicaid with an enhanced benefit up to the age of 21. We provide the access and screening for that, and we develop the eligibility packet to send to the state to see whether or not the individual can be enrolled in the benefit. So one of the things that this will allow for is an expansion in our ability to provide some very evidence-based services to individuals with autism that currently have been excluded because Medicaid did not cover those individuals. The other things that Mary Beth asked me to highlight for you was state legislative updates. The House Appropriation Committee passed the HICA extension, which is the Health Insurance Claims Assessment. This was set to sunset on 2017, and this provides about $250 million that the state uses to pull down as a Medicaid match. If this is not approved and not extended, this will force the general fund to fill that gap. For that, which will forfeit around $1.3 billion in Medicaid revenue for the state of Michigan. So we're very hopeful that this will be extended. Medicaid marijuana legislation, there's legislation in place right now to create a regulatory framework for Medicaid marijuana, medical marijuana, which will also include a 3% tax that will allow some regulation around the dispensaries and also ability to tax those and create some revenue. It is tie-barred, though, to a previous bill that was introduced a few years ago around testing, roadside testing, so when an officer would stop an individual who they felt may be under the influence. There's been legislation proposed previously on how they would screen for someone being under the influence, and right now that is tie-barred to an additional bill. And finally, the medically frail parole bills. Last month when I was here, there was a little bit of discussion that Mary Beth asked me to give you in regards to a bill that was introduced for individuals who would be coming out of prison who were deemed medically frail. There has been additional information provided with this bill that would allow them a chance at parole, but they need to agree to be placed in an appropriate medical facility, which would be a nursing home. So they would go right from the prison to a nursing home, which is new clarification that we did not have last month. And those are all the updates I have for you.
Thank you. What comments or questions might you have? Commissioner Rice?
In regards to the medically frail, coming out of incarceration and going to some type of care facility, whether it be residential or some type of medical care, what have you. Once they got there, how is that going to be paid for?
Well, this is one thing that, Medicaid and Medicare currently pay for individuals that reside in nursing homes. I do not know if the Department on Aging at all has been looking into this also. This is new clarification that we received in the last month, that this will be tied to an agreement by the parolee to be transitioned directly from the prison into the medical care facility. Historically, that is paid by Medicaid and Medicare.
All right, thank you.
Mm-hmm.
Thank you. Commissioner Duckham?
I wonder if you could give me some insight with the push to basically decriminalize marijuana, make medicinal cards easier to obtain. Does anybody have any idea where these people that have these medicinal cards are going to be employed?
Not that I'm aware of.
Well, I run a trucking company. I have 75 employees. And federal law says you can't have the commercial driver's license and a medicinal card. So who's going to take care of and feed these people? I would submit that probably there are many industries in town that are actively seeking employees, and probably a drug screen would be in order as a pre-hire. People with a medicinal card probably can't pass a drug screen.
Correct.
Who's going to feed these people?
I don't have an answer to that from the mental health perspective. I do know in speaking, I live in Hillsdale County, and speaking with employers down there, that's exactly what they're running into. They have lots of people applying for jobs and people who can't pass a drug test. Not always because they have a medicinal card, but they're running into the same issue
But
down
we're
there.
making it easier,
For them to,
yes, to partake.
yes, absolutely.
Okay, I'm kind of scratching my head wondering.
And our local substance abuse coalitions, I know both in Jackson and Hillsdale, are also wrestling with this, trying to figure out how to create a framework and structure around this, working towards prevention and treatment for individuals who have a medical marijuana card, and then how to help them access other systems that they may need to access, and not viewing that necessarily as a negative.
You mean like general assistance?
Could be.
Well, that's what they're going to need.
Could be. Could be a different type of job. Not every job has a drug screen.
Okay, thank you.
Thank you for offering your expertise, Ms. Clevenger. Next on the agenda, Department on Aging. Ms. Wendell?
Okay, good afternoon. This month, I thought I would update the committee about some things that I've reported on in the past. And just to review that services at the Department on Aging fit into the county strategic plan, primarily with the health focus, because our mission is to help older adults live full and active independent lives for as long as possible. And a lot of our programs fit with healthy eating, exercise, and other services. And it was just over a year ago when I talked to the committee about our Department on Aging strategic plan and how that reflects the county's priorities. And at that time, I talked about one of our target areas, which is having a quality workforce. And one of that, by having that, then we're better able to meet client needs, client preferences. So one thing we wanted to do was to lower the turnover rate of our home care workers. And so this is some information on how that has happened. Quite a drastic reduction comparing 2013 with 2014, and it did creep up a little bit in 2015. So it is something that we continue to work on, because having consistent workers is more consistent for the clients. So that's one of our things that we're working on.
And the salaries were the same over that period of time?
We did increase the casual pay rate.
Significantly?
Not significantly.
Okay.
But some.
Minimum, but some?
Yes.
Do you think that could have played a role in?
That was a factor, increasing a casual worker is someone who works 19 hours a week or less, and also the Board of Commissioners approved our adding 3 part-time workers. So that has contributed to lowering the turnover rate, because then they can work up to 29 hours a week and have paid time off. So those 2 factors, I think, were pretty crucial.
Thank
Yeah,
you.
so thank you for the question. And the other update is regarding to revenue for counseling. We do have senior millage and a grant through the Area Agency on Aging for counseling. But in 2011, I reported that we went through the hoops in order to be eligible to bill Medicare for counseling. And this is then a chart of the revenue we've received from Medicare for counseling. We started the process to bill Medicare because Medicaid waiver through the Area Agency on Aging, they were referring their clients for counseling. But before we could bill Medicaid, that's for low-income adults. Before we could bill Medicaid, we needed to bill Medicare. So we did the paperwork so we could do that. And then in 2013, Medicaid waiver no longer funded counseling. So we didn't bill Medicare as often. So at the end of 2013, and the staff, the licensed social work staff became more familiar with billing Medicare, and the health department's accounting staff have helped us out as well, and they send in and process the Medicare billing. So it did jump up in 2014. We just have, staff are very careful that we don't bill Medicare and a grant. Can't do that. Has to be, your expenses for Medicare-related counseling are separate from that's billed to a grant. The time is separate that the workers, social workers, give to a client or provide service to a client. And the reason that the Medicare revenue went down for counseling in 2015 is the full-time social worker was on a leave of absence for 3 months, so we weren't providing as much service.
On an average, how often are individuals receiving this counseling?
I will bring that back to you. I'll look it up, and normally it's short-term counseling, which is considered 8 visits or 8 weeks. And we do provide it in the client's home. I mean, they're welcome to come into the office, but primarily we receive requests from people who are homebound and can't get out. So it is grief counseling primarily, short-term, 8 weeks. So I can come back and give you more information about how many clients we see at a time, and in a year about how many clients we see.
So then you answered the second question, is it with Medicaid fund,
Medicare?
if it was, yes, with the Medicare, if it was a limited amount of time in which someone's eligible for that before they're no longer, but it is a set time to start with, so
Yes.
usually.
And there's exceptions, depends on the situation. Some it's longer, some it's shorter. Some may start for a while and then they decide to stop. And then 6 months later, an event will happen in their life and they'll contact us again. So it can vary. Yeah. Any questions? Other questions?
The last page, was it? Comments or question? Commissioner Rice?
Hey, Marcy. Clarify for me again, if a person is Medicare, Medicaid eligible, how was the billing process in regards to counseling at that point?
If they're Medicaid waiver, which we no longer have those situations, but if they were, we had such clients that were Medicaid waiver eligible, the Medicaid guidelines state, well, first you bill Medicare, and then the balance you bill to Medicaid.
And the Medicaid waiver is not available now?
Correct. I'm not familiar with the specifics on what happened, but someone on a state or federal level told the area agencies on aging the parameters for authorizing counseling changed. And when that happened, the referrals for counseling basically stopped.
Okay, thank you. Apparently these people on the state level or legislative level don't understand that our elderly population is the #1 population that needs mental health care when it comes to grief, anxiety, depression, things of that nature. So apparently, apparently they weren't very educated. Thank you.
Any other comments for Director Wendell? Thank you for your presentation. Next on the agenda, we have Community Action Agency Quarterly Report. Good afternoon, Ms. Berry.
Good afternoon. I believe you have a copy of my NSP program update in your packet, and I just wanted to point out our most recently sold house was at 121 Hall Street in Michigan Center, and that was a Habitat home, so that was sold to a Habitat eligible family. We currently have 2317 West Franklin under construction, also with Habitat. 303 Broad Street, I was told today, is completed, and so we will be getting an appraisal on that property and putting it on the market as soon as we can. We have one property remaining for development, and that will be with Habitat as well, in order to meet our low-income 50% AMI requirement. hopefully, fingers crossed, we'll be closing out NSP within this fiscal year, Community Action Agency's fiscal year, which is until October. So my goal is that we can get 914 grant started relatively quickly, and we can not have to come here and report on NSP anymore. We have done pretty well with program income. We've brought in over $400,000 that we've put back into our communities and have completed 11 demolitions. I also brought with me a copy of the Project Homeless Connect flyer, which will be happening January 27th. From 10 to 2, and that's at the American One Event Center. Bringing this on behalf of the Jackson County Continuum of Care, which is a group of community organizations that really focus on addressing homelessness in Jackson County. We facilitate about $1 million of funding into our community every year for families who are homeless or at risk of homelessness. This Project Homeless Connect gives us an opportunity to kind of provide a service fair for families who are at risk of homelessness or experiencing homelessness. We provide lunch, we have vendors who come in, they give free haircuts, those types of things. Also this year it will be happening in conjunction with our Show Me the Money Day, which I believe we're partnering with the treasurer on, which will be providing some financial education and other information around financial stability. The only other thing I wanted to mention is that we're gearing up for volunteer income tax assistance season, and Community Action Agency will begin taking scheduling appointments on January 20th. This year, the household income is $54,000, so if your household makes $54,000 or less, you're eligible for free income tax assistance. We will also have an opportunity, the web link is not live yet, so I can't kind of give you that link. There's a partnership with H&R Block that for families who are able to do it themselves, if they make $62,000 or less a year, they can link in to a link through our website, which as soon as that goes live, I'll make sure to get you that information, and they can do it for free themselves through H&R Block, and that's at $62,000 a year. And we'd like them to access that through our website because that helps us, it counts towards our numbers in the number of families who receive services. And that's the end of my report.
All right, so I'm understanding the income tax program starting February, or what's the earliest you can schedule an appointment for?
I believe we're starting scheduling in January, and I believe the first appointments are in February, but I don't have that information right now.
It's coming up. If you could ship that my way
Yep.
when you have access to that, and we can make sure that individuals have that available to them, because that is a significant, if you send it to the full board, Toby.
Sure.
I mean, for those individuals, it's expensive to even file your taxes, and to go through the process, that's a great resource available to people. So, please share that information with us.
I will do that.
What other comments or questions might you have for Toby? Commissioner Rice?
Hey, Toby, appreciate the report, and I know you're definitely glad to be getting this NSP done. We've said this before, and we keep talking about this. Now Broad Street being finished, and then you've got Grant Street, like you said. Once those properties are sold, that money will be utilized, in what way?
The Broad Street funding will probably be utilized to complete Grant. And then with our partnership with Habitat, we don't actually receive any program income from that. So hopefully these last two projects will spend us out.
Okay. All right, thank you.
You're welcome.
Okay, thank you.
Thank you.
Next on the agenda, Animal Shelter 2015 Annual Report.
Good afternoon, everybody. I hope everybody had a good weekend. As you can see from my submitted report, we had a pretty busy year. We're actually extremely happy with the year we had as well. Again, Friends of the Animals of the Jackson Area Incorporated did step up quite a bit financially in support of the animal shelter in 2015. They did fund probably the last Pets for Veterans campaign back in July. Until said time, they can replenish that fund that they utilize for adoption fees. And also, they have also provided some direct and indirect support for spade and neutering surgeries within the animal shelter, helped defray the cost of the community cat project. It's been a big help for us. They also had their second annual golf outing in September, which proved to be a phenomenal success, doubling the amount of proceeds that they brought in from the first annual in 2014. So we've already reaped some benefits from that. They brought in October, November, and completely redid all of our cat and dog beds. They're all elevated beds, including within the cat room itself, elevated beds so that it's a much less stressful environment for the cats, better hygiene, better infection control, everything along the lines there. And then, of course, now we have a full year under our belts for the case management software system, that Chameleon, that we had purchased through a grant. And it's proving to be very worthwhile in terms of dollar savings for time, being able to pull statistics, keep track of animals. It's a lot less labor intensive, so we've been happy with it. We actually did 3 adoption promotional events in 2015, starting in August. Then we did a Halloween event, and then we finished up in December 19th, I believe, on a Saturday. And all 3 events were successful in our minds, increasing adoptions during those particular time periods over and above what normally would have occurred. The December 19th was a raging success. We had 20 cats and 5 dogs adopted out on a Saturday. Unbelievable. And to date, only one of those animals has come back and for a refund. It really wasn't a refund. They just donated the reduced adoption fee. It was a medical issue that the dog came back. I also want to bring to your attention, as you well remember from previous reports, Dr. Anderson, our veterinarian, did break her arm back in the spring. We brought on Dr. Erin Whalen to backfill for her, amongst other options. She came on as a casual, and I'm keeping her on as a casual to fill in for backfill for Dr. Anderson. For instance, the last week of January, Dr. Anderson's going down to North Carolina as part of a ASPCA response action to do some coroner forensics work. So for that week, I'm going to have Dr. Whalen provide a surgery day. So that's there is no actual cost increased because her rate is actually the same, or $5 less, I believe, than Dr. Anderson's rate. So it's proving to be helpful from a scheduling point of view. The security system has been installed. That was another thing that Friends of the Animals did for us. It helps our front clerk keep tabs on the back area as well as the puppy room. We're going to probably try to find a couple other areas to put under camera surveillance for the clerk to pay attention to. Seems to help her as well as our staff in general from a safety point of view. Back in last August, I brought in a crisis grief counselor from Deepwater Counseling who has experience in compassion fatigue, in particular in the animal sheltering industry. By August, my staff tend to be pretty burned out from the workload that's out there, along with the euthanasia, because that's obviously the busy part of the year. And so this has actually helped to get them past that hump, so to speak. I have every intention of doing that again this July, August as well. Facilities brought in some insulation and energy-efficient lighting, and I can tell you, the upstairs room is phenomenally better. It's no longer 90 degrees plus up in that upstairs room for me. I'm a happy camper. And just about a month ago, a couple gentlemen from Consumers Energy just came by, did some cold calling for LED lighting, and basically I got on the list for 40 free LED light bulbs to replace the fluorescent tubes. It's not going to be an energy saving, but it is going to be a long-term replacement since LEDs last a lot longer than CFLs and the T8s that they had been installed by facilities during that energy-efficient lighting install. And then we have a Knox box for law enforcement, which I've heard no complaints about. It is in operation. Police have their own box to get a key after hours. The outdoor exercise, and the cat condo projects were completed in 2015, thanks through funding from Friends of the Animals, TAC Manufacturing, and Dave Klein. And then we did some work very recently, about a month ago, to provide a couple extra clean-outs for the back kennel drains. We're starting to have some problems in this one particular area, so we put in a couple extra cleanouts to help facilities come out and snake when needed. We build up a lot of dog hair for obvious reasons. And that, the final page, as far as activity levels, just a couple points to bring out. Our intake numbers went down a little bit, about 10%, 10 to 12%, most of that being in the cat intake numbers. In particular, that was a 10% decline, kind of showing that our efforts at spaying and neutering seem to be working, although I will say the rate of decline is starting to level out at this point in time. So the low-hanging fruit has been harvested. We're in the toughest part at this point now. The dogs numbers remain about the same, and our euthanasia numbers remain about the same as far as percentages goes. That's about it for my report. I'll take any questions that any of you might have.
Commissioners?
I'm not sure if this is a question for you, Don, or a question for staff, but have we ever recognized in a positive way Friends of the Animals?
Yes, we do. They have a couple plaques. I bring it to your attention. I try to let people know whenever possible that subject area comes up. So there have been newspaper articles. When a reporter comes by, I always try to get their name in there to make sure that they're given the correct due that's due them. That's not great English, but
Administrator Overton?
I would just encourage everyone, if you've not been out there recently in the last year or so, to go out there. The cat house, or cat condo, for lack for a better term.
cat condos.
Cat condos with the hammocks and everything it's pretty awesome. And it really is. They're doing a great job, and especially go out for one of the special events. I don't remember if it was Halloween. I think I might have been there Halloween or whatever it was, but with one of my daughters. And you can tell that it's these people. Obviously they work for a paycheck, but they really love what they do and are making a difference in our community. And I think you would all be proud of the work they do if you got out there and took a look sometime at what's really happening out there and the improvements.
I appreciate that, Mike. That Halloween event, that was a big event. 5-6 different businesses contributed funds to help defray the costs of all these events. So there was, other than some, a little additional labor cost, there was no cost to the county for these events, and they did increase adoptions.
Commissioner Shotwell?
I'd like to commend you on your hard effort and due diligence out there and the work you guys do. Have you ever considered the Friends of the Animal Shelter possibly becoming more involved? I know that the airport, the parks have advisory councils that actually help them review policies, go through information, help support staff on volunteer basis, and have more formalized their relationships with their friends committees. It might be an opportunity for you to take better advantage and also recognize the hard work that those people have. And that way, when they can take more ownership of the animal shelter. I know most of them believe it's theirs now because of the work they do, and I really appreciate that. And I know that that at the airport, by engaging the Airport Advisory Council, we were able to get all of our policies reviewed, with them being looked at from private users as well as government officials and the public sector, or the private sector of business. Just a thought maybe that a more formal relationship with them down the road, I'm not talking next week, but as you go forward with opportunities, their ownership, and then again, they could help maybe other parts of the county with that also. I know that our park system and such are looking at good uses of our parks resources over the next couple of years, and I know the Friends of the Animal Shelter, I'm sure, would like to have some input maybe on animal runs or something like that on a go-forward basis, and if they were a little bit more formal arrangement with you, then that might help with that. Just a thought.
Right, and honestly, I had not really thought of it in that formalized structure previously. We do have some grandiose, very long-range plans for the animal shelter property, because we do have that back building that's vacant. We use it for storage, but it's basically very much underutilized. We do have some really long-range plans that would require additional funding mechanisms for obvious reasons. And so the intent was to create a work committee, of which they would have been a part of that, along with some of the private veterinarians, to discuss what can happen with this property down the line. But your suggestion of an advisory council, I definitely will approach administration to see how does that get set up, what are the parameters, everything along those lines, because that's a good idea, absolutely.
All right, seeing no other comments or questions, thank you for that update.
Thank you.
Next on the agenda, we have Health Department Monthly Report. Richard, good afternoon.
Good afternoon, all. Everyone obviously has my report in board docs, and I'll just scan through this and identify a few things I want to bring to your attention. We did have our employee appreciation breakfast the first week of December 9th, and it was very well appreciated, and we had a lot of fun with that event, as we do every year. I previously talked a little bit about the medical waste disposal contract changes that we made when the board previously reviewed a new position for the health department with a public health nurse, and this is where some of those funds came from. We were able to renegotiate the terms and conditions of the agreement with our waste disposal contractor, and I think in the process what we found out and figured out was we really were purchasing what I would describe as a Cadillac plan. We didn't need to do that. And so we really scaled it back to just what we needed, and we're saving that amount of money that you see listed in my report there, $24,000 over the next 12 months. So I think we really are much more pleased at this point in time to be able to take those resources and putting them back into staffing where we really need it in the health department. One of the things that we're also looking at and trying to get a little bit more engaged on is opioid prescription use in our community. We participated in a couple of different opioid summits in December. One was at University of Michigan, the other was with Jerry Jarzinka, the county prosecutor, when he had that at Jackson College. And I think we came away with maybe perhaps more of an understanding of just how significant this public health problem is in the community. It's not just law enforcement and a medical problem, it's a public health problem as well. People are literally dying. And we want to see if there's something more we should be doing from the health department than what we have been. We do have membership in the Substance Abuse Prevention Coalition, so we're there, but we want to talk more with Prevention and Community Health Backbone support staff and the coalition about, is there something else public health could be doing, working with our community partners on this issue. So it just kind of highlighted it for us. There's a lot of information, I think, that we probably want to know that we don't know at this point about how this problem actually looks in Jackson County. We don't know the number of ED visits that have occurred. We don't know the number of hospitalizations. We have some sense of the number of reported overdoses to law enforcement and also overdose deaths, but we're looking for a little bit more information to help support the planning that we think is needed. So wanted to share that with you. We're continuing to do a lot of things with health integration. The Health and Human Services Access Coalition will be meeting next week, if you will, and the Health Department has agreed to serve as a champion agency for that coalition. It will be looking primarily at how we can work together better to identify health service access opportunities in the community, whether there are changes taking place, whether we're planning on new things, and just have a coalition that can look at that in a little bit more detail and help plan it better than we have done in the past. The Community Health Innovation Region, there was an interview for the State Innovation Model that I participated in on December 9th with MDHHS consultants and staff to answer questions about that. They did submit a capacity assessment, and we were described as having done a really good job with that. We're pretty confident we're going to be one of the 13 selected regions, if you will, in the state for the State Innovation Model. And so we probably will find out a little bit more about that between January and maybe into February of this year. So we'll let you know what we find out about that. We're hoping that we're going to have the opportunity as a community to kind of describe how we'd like to pilot test the State Innovation Model versus being told this is how you do it. We're really hoping that that will be the case. We're not entirely sure yet. So I guess we're a little bit on the fence in terms of deciding to actually jump on board and do this pilot until we know really what it consists of. So we're working on that. I was pleased to hear Commissioner Shotwell's comments about Friends of the Animal and advisory councils. I think that represents really what I would describe as community engagement, which is something that we want to do more of on the health, the public health, and the health services side of the community work that we do in Jackson County. So as you can see, 2 of the coordinating councils now have come together with members that were previously committees of those councils, and now we've elevated it to a higher level in the community where we're doing much more kind of cross-sector, cross-strand conversation about how to engage with the community better in planning the services that we provide to our citizens. So we're looking forward to that moving forward as well. Mental health provider survey, the initial survey that was done went out back in probably November, and we had a subsequent meeting in December and looked at some of the early data with it. What we figured out is we need to do some more surveys. We don't have enough yet, I think, to feel comfortable where we're at and learning about the same kinds of questions that we pose to actual healthcare providers, we've now posed to behavioral health providers as well. So we're hoping that'll help inform some of our system work. It's been pretty busy in the Personal and Preventive Health Services Division with recruitment. We've had a number of positions that have either becoming open because of retirements or we may have had a resignation. The Clinical Services Coordinator position was one of our key positions in that division. Nikki Myers started today with us at the Health Department, so we're really pleased to have her on board, and I think she's going to do a great job for us. We also are offered and had a position accepted by Kathleen Brutschke. Kathleen has previous experience as a public health nurse in Calhoun County, and she had family in the Jackson area and wanted to relocate in this direction, so we were very lucky to be able to bring her on board. She has a lot of that experience that is oftentimes hard to get unless you've already been a public health nurse someplace else within the system. So she started on December 28th. Sandra Stevenson is a casual social worker that we brought on board in December to work in our early on program. We're pleased to have her. And then we're working right now to replace Tracy Fowler, one of our registered nurses who was working in our STD and immunization clinic. So that position has been posted. World AIDS Day was December 1st, and just wanted to let you know that we did do a press release for that day. And we actually were pleased to see that 6 people who had never been tested before actually came to our clinic and were tested. So I think that's a really nice outcome to have achieved. As you're probably aware, HIV incidence in our community is higher than what we'd like to see it. And I know that more work needs to be done, but one of the ways we help prevent further transmission of this is to get people in and get them tested so we can educate them as well. Some updates under health education, health promotion, some post-grant activities with the Building Healthy Communities grant is described there in the Loomis Park area. Julie Weisbrod has done a really good work with that particular group and really has, I guess this might be a really good example of how our staff have facilitated empowering a group like the Friends of Loomis Park to actually plan what to do with grant funds. So it wasn't the health department coming to them and say, here's what you should do with them, tell me what you'd like to do with them. And I think that was a really nice outcome that we've achieved in that neighborhood. A lot of teen pregnancy prevention initiative updates from December. The Teen Outreach Program continues to work with many of the schools out there that we've described to you before. The I Wish video continues to be discussed and shared with many of the school districts, and we're hoping that we'll continue to expand the use of that as part of sex education in the school districts. We have a new partnership with the Higbee Street Church of Christ, and that started out with the showing of the I Wish video, and we're hoping to do more with them in the future as well. The Teen Advisory Council continues to meet, and it's got 20 active members who are high school students. So again, I think that's kind of another good example of how we're engaging on the teen pregnancy side of things. We're excited to look at the possibility of purchasing and maybe even getting donated or partially supported the cost of purchasing a lead analyzer 2. This is a piece of equipment that sits on a bench top in the WIC clinic, that would sit on the bench top in the WIC clinic. What it does is basically give us instantaneous results of lead testing of children. So we wouldn't have to send our samples up to the state. We'd have them right there while the family's there, and if they were elevated, we'd coordinate directly with them right there on the spot to get venous testing done through their healthcare provider. So we're really excited about it. We think it would actually probably save us some money in the long run, because for lead testing that we do for children who are not on Medicaid, we actually have to pay for those tests because we don't bill private insurance now. And this might actually be a way for us around that and enable us to test them right on site for less cost than what we're paying to pay the state. So we're hoping that that will happen. We actually have that meeting this afternoon. Under environmental health, as you're probably aware, we did extend the agreement with Primetime Steakhouse and Spirit Status through basically the end of this current licensing year. And we just wanted to give the facility as much time as they felt they needed to make the corrections that were necessary. They weren't where we wanted them to be when we got to the end point, if you will, of the first agreement. So we extended that right through the 1st of April, approximately. So if we can't achieve compliance by then basically the license will expire. And if the license expires, reapplication can be made, but they'll have to go through the whole plan review process to do that. And frankly, I think that's probably what needs to happen, because there's so many things that need to be corrected that the plan review process may really be the only way to get them there. Couple of updates, type 2 program update. Don has indicated that his staff are sending out reminder letters to type 2 well owners concerning any remaining sampling requirements for their supplies. And we do this a few times a year. And tattoo parlor updates, we continue to make sure that they're licensed in the community. And we did have one particular facility that did not renew its license. We had a little bit of a requirement to issue them a cease and desist order because their license expired. They were still tattooing. He said, no, you can't do that. You have to stop. And they did stop. And as far as we know, they have not gotten relicensed, but they're also not tattooing. So they're meeting the requirements of the law.
Do you ever have to get the law enforcement involved in an issue like that?
We haven't so far, and we're hoping that it doesn't come to that. But I suppose if push came to shove and they didn't comply with the cease and desist order, we'd probably be seeking an injunction through circuit court to require that the facility be closed and padlocked.
Right. I mean, and going back a little bit, back to the issue with the licensing of the restaurant establishment. I mean, what I'm reading here is they could effectively lose their liquor license as well, and
That's a possibility.
so that's significant. I mean,
Right.
that is a value.
Mhm.
So you've got your hands full, don't you?
Yeah, and we did have to make the point that the absence of being open for food service operations does not mean that they couldn't be opened for bar operations, because these are two separate licenses. One is not contingent on the other. But the owner did decide to completely close the facility and not try to serve alcohol and spirits, if you will, while he was closed for food service. Kind of hard to do that, because ice that's produced in a bar facility is considered food, and so it's subject to the food license. So it gets a little
So
complicated.
the only other option would, if they brought in ice, that
Yeah.
would be acceptable?
That would be the only other way you could do it. So far, that hasn't happened. The only other thing I had on my report under environmental health was expired well permits, and we do reach out to owners of expired well permits to make sure that they're aware that their well permit's going to be expired. Sometimes people take a well permit out, they don't necessarily drill the well, and eventually the permit will expire, so we just want to remind them that we have it on record, and if they do want to move forward, they need to get in touch with us. I won't go to the animal shelter. I think Don has already given you his annual report for that, so I'll skip those items in my report today. That's all I have for you.
Commissioners, what comments or questions might you have? Commissioner Placzek?
Yes, Richard, how much is that lead analyzer, and how much will you save when you can do them yourself?
The lead analyzer is about $2,300, but right now it looks like we might actually be able to lease the machine from Magellan Diagnostics and just buy the test kits, which run about $7 a piece, from McKesson. So that's hopefully the direction we're going to go, so actually it won't cost us anything to put the machine in place, other than buying the kits. And we can bill Medicaid and get pretty much reimbursed for the cost of the kits, but if we use a $7 kit to test children who are not on Medicaid, that are on commercial insurance, but we don't bill commercial insurance, we'll probably save roughly about $10 to $15 each. And so that'll kind of more than pay for itself, if you will, compared to what we were spending in paying for lab tests through the state lab.
So
we're
one
thinking-
way or the other, it's billable, though.
Yes. Yep.
Any other comments or questions? Seeing none, thank you, Richard, for that
Welcome.
report. Next on the agenda, again, a contract service agreement that you would like to present to us again with the ISD.
Yep, this is an annual contract that we've continued to receive from the Intermediate School District, and the funding source is a grant through Great Parents, Great Start. And although this contract is about $14,000 less than it was last year, we still would like to enter into the agreement with the Intermediate School District. It's only $20,000 this year versus $34,000. But what we do is we will scale back the number of families we can serve so that the staff time matches the available resource. So that's what we typically do.
All right, so I am looking for a motion to accept this agreement. Motion and support. All in favor, say aye. Aye. Opposed, no? All right. Contractual agreement approved.
Thank you.
Next on the agenda, the second contract with the Michigan Public Health Institute for participation in field testing, a home visiting quality assurance system tool.
Pretty lengthy description. Apologize for that. Our staff have been actively engaged with MPI in helping them field test this quality assurance system tool. The first contract was unique from the perspective that they had to have it in place for I think it was the August through September timeframe because of their own grant contractual requirements with either MDHHS or the federal government. So this one closes out the whole contract period and fills the gap for the remainder of the time that we'll be doing this work. So this second agreement covers the period November 1st through September 30th.
All right, if there are no questions, I'd be looking for a motion and support. We have a motion and support. All in favor, say aye. Aye. Opposed? Nay? All right. Participation to participate has been approved.
Thank you.
Thank you. Next on the agenda, we have the claims, the December claims that were presented to you. We have a motion and support. All in favor, say aye. Opposed, no. Such excitement, motion passed. We have other meeting minutes. We have the Human DHS Board meeting minutes attached to Board Docs. We have a February reporting schedule, Department on Aging, Health Department, and Lifeways. That leads us to our second public comment. Is there anyone that would like to address the Board of Commission? Human Services Committee. Seeing no public comment, are there any committee member or board member comments? Seeing none, we'll adjourn to the call of the chair.